are going to charity. Click buy, click and watch. Let's do it.
Just say again really loudly what happened.
Okay, I burned my foot very badly on my Foreman grill, and I now need someone to come and bring me into work.
How do you burn your foot on a George Foreman grill?
I enjoy having breakfast in bed. I like waking up to the smell of bacon. Sue me.
I don't really even recommend eating bacon because it's a processed meat which has a cancer risk. I mean, if you have it every now and then, it's not the end of the world. Do not cook it in bed while you're asleep with a hot,
Today, I got up, I stepped onto the grill, and I clamped down on my foot.
Oh, that looks so fake, by the way. It would be burnt, it would be bloody, there would be skin peeling. That looks like he just, like a little cat scratch. I had the worst experience when I was a kid. My sister was using one of these pots. The pot actually you use to steam and like breathe over to help your sinuses. She asked me to bring it from the kitchen after it boiled, and as I'm bringing it, I spill it all over my crotch. Oh my God.
What was that?
Oh! He hit the pole. It's broken, right? He can't.
Oh my gosh.
Oh, Dwight.
Oh! If you're throwing up immediately after a car accident, that's a potential sign for serious head trauma. You better be calling 911.
I am feeling better. My body's literally healing itself. It is amazing what the human body is capable of when you have a powerful brain.
I ground up 4 extra strength aspirin and put them in Michael's pudding. I do the same thing with my dog to get him to take his heartworm medicine.
Don't give people medicines that they're not ready for. Aspirin especially, it has all sorts of interactions with other medications. Some people are sensitive to aspirin. Like if I take an aspirin tablet, my nose bleeds because it actually impairs platelet function. If God forbid they have a procedure coming up, that would be detrimental. Children, if you give them aspirin, they can develop Reye syndrome. Please don't just dose people with aspirin just because you do the same thing with your dog. Bear's good at taking pills.
Oh. Okay, I think we need to take him to the hospital because
Oh no.
I'm pretty sure he has a concussion.
Oh, now you feel some compassion for him.
He needs to go right now, and you're his emergency contact. I think you should go with him.
Why don't you go with him?
I barely know him.
I want Michael to take me.
I can't take you. I don't have my car.
Why don't they just call 911?
Wake up.
Oh no, don't do
Let me
that.
help you, Dwight. Come
Okay,
on.
I'm gonna get
Get up. Get up.
You're the best.
Yeah.
Just keep him away.
Smells like chicken soup.
I know.
When you have a concussion, you need cognitive rest. Less lights, less sounds, less interaction, less movement. You need your brain to recover. And the worst concussion is actually your second concussion. God forbid you ever get a concussion in, let's say, a game. Do not go back into the game because the second concussion is going to be much worse.
What is more serious, a head injury or a foot injury?
A head injury.
Well,
So I'm ordering a CAT scan.
What is that?
The reason we get CT scans when someone's involved in a car accident, for example, is because if you have bleeding in the brain, it's an enclosed environment. The skull actually prevents blood from being able to displace the skin. And as a result, pressure builds up, and that could be really problematic outside of the fact that you're not getting enough circulation to the brain. We actually followed a specific set of guidelines known as the Canadian Head CT guidelines. You basically look at what the patient experienced, look at the type of trauma they had, what symptoms they're experiencing. You plug in the score, and it basically recommends whether or not you should have a CT scan. Remember that most CT scans expose you to as much radiation as between 100 and 1,000 X-rays. So if you don't need that excess radiation, you really shouldn't be getting it.
I'm having contractions, but they're irregular and far apart. So I'm not really in labor, I'm near labor.
Sometimes you can have false contractions when you get close. They're called Braxton Hicks contractions. Sometimes they're not sure. That's why they call our on-call answering service, and we give them some guidance.
Labor can last weeks. Then they take your insides out and they just plop them on a table, and sometimes epidurals don't work. You can poop yourself.
A lot of people poop during deliveries. I think I delivered like 30, maybe 40 babies during my residency training. And I would put the poop rate somewhere around 60, 70%. Safety of the baby and safety of the mother, most important, most important, most important, not the poop. Never thought I'd say that statement.
oh, hey, should I bring a dictionary to the hospital?
The hospital will provide dictionaries. Bring a thesaurus.
You need a dictionary or a thesaurus in a hospital.
This is ridiculous.
Dwight, get away.
No. Dwight, let Jim do that, please, okay?
I didn't know we had a tape measure.
We don't.
Was he gonna measure her cervix dilation with that? We do not put tape measures inside human bodies to measure anything. Again, another statement I never thought I would make.
Cam's doing great. She's 10 inches dilated now. Sorry, meters. Centimeters.
10 meters dilated. She's 30 feet dilated.
And she's also fully effaced, which I don't know what that is.
That means the babies
but no
are
baby
coming.
yet. It's only been 19 hours.
Halpert room D1. All right. family only beyond this point. Thank you.
It actually says patients and staff only. Normally we have a check-in desk where visitors have to check in and then we check to see if it's a good time for them to come in. We don't just let people barge in the midst of a delivery.
Babe, she's so beautiful.
Crying baby means a healthy baby. Why is he smoking a cigar?
Yeah. That's right. It's a baby, see?
Yeah, you shouldn't smoke in a hospital where there's oxygen tanks.
Ready? 1, 2, 3.
That's called the burrito technique. Very important to learn early on because it helps coddle the baby and helps him sleep.
Careful though, you don't want to break it.
She's not gonna just.
I got it.
Just the other day, I had first-time parents come in. They're nervous, and they're good nervous because they're excited. They want to do the right thing. They're asking a bunch of questions, but it's awesome because then the baby comes in for sometimes a newborn weight check, or sometimes they come in right away at the 2-month first visit for vaccinations, then 4 months, and 6 months, and you get to see the baby grow. Like it's one of the most fun parts about being a doctor.
I can't tell if she's getting anything.
Really?
It doesn't feel right.
Well, you're pushing the milk out, right?
How would one do that?
Wasn't it? It's kind of like
No, you don't push milk out. The baby has to latch, and sometimes it's a process. The baby has a tongue tie, the breast anatomy. Sometimes it can be problematic, but it's all solvable. We have lactation specialists that meet with the moms. Perhaps they can do some supplementation, especially early on. It really depends on each individual case. But the general recommendation is to be breastfeeding your child.
Fire. Not real. This was merely a training exercise.
What?
So, what have we learned? Oh, come on. It's not real, Stanley. Don't have a heart attack.
No. Check for a pulse, call for help. If he's not pulsating and he's not breathing.
Chest compressions, chest compressions, chest compressions.
Andy?
A throne for your highness.
I'm not sitting in a wheelchair.
No debate. You are going to sit in that wheelchair.
You actually don't want to be sitting in a wheelchair when you don't want to. That could actually decondition your heart, your body. You want to be as active as possible to the safest degree. Why? Because you actually are training your heart, you're burning calories, you're keeping your metabolism up. All these things are really positive to decrease cardiac event risk, especially when you've already had a first heart attack.
ABC, okay? And that stands for airway,
breathing, and compressions.
circulation.
Okay.
I threw in the compressions just because I love the compressions. Because if there's no circulation, what do? I heard you say it.
I can't keep doing this forever.
It's been 20 seconds.
2 minutes.
Call it.
Call it. No, you do it until you realize that it is futile. Just to make it clear, I feel like this gets confused for most people when they watch these shows. If someone has a heart attack, it doesn't always mean that they need chest compressions. I've literally seen someone discuss this before, where they're like, oh my God, my family member's having a heart attack. Start chest compressions. No. Yes, heart attacks can sometimes lead to your heart stopping where you need chest compressions. Not all heart attacks need chest compressions. Person's awake and alert, they don't need chest compressions.
You're losing them.
Those are bad chest compressions, not deep enough, too fast. You want to do it to the tune of 100 beats per minute. There's a lot of famous songs that you could do it to. I like Staying Alive. I would sing it. I'm not trying to get demonetized.
Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
Check for an organ donor card. If he has one, we only have minutes to harvest.
He has no wallet, I checked.
He is an organ donor.
He is? Yeah. Give me some ice in a styrofoam bucket.
Whoa!
Here we go.
Did he just whip out a knife?
I feel like a banana split.
Oh, did we tear a groin muscle? When office parties get buck wild. I also don't know, he could have injured his testicular area.
I was dancing and I did a split and I landed on my car keys in my pocket.
Oh, I did not expect that to be the diagnosis. What is the ICD-10 code for that? What do you think is a worse story? Crashed a car because of a tiny spider or tore scrotum?
Every single day.
Wow, 30 cans. What is it, 12 ounces per can? 30 times 12 is 360 ounces. It's a 2 liter, 64 ounces. That's basically 5 of those. She drinks 5 2 liters a day. Holy moly. First problem right off the bat, tremendous amount of added sugars in each one of these cans. If I was to show you, before I pop up the image here, how much actual sugar is added to each one of these cans, it will blow your mind. Take a look.
The most I had probably in a day is 50 cans. I'm always drinking cola.
Also, not good for your teeth and not good for a lot of body parts. Also, what else is in cola? Caffeine. That's a ton of caffeine, especially if you're taking it at night. There's no way you're getting restful sleep on that much caffeine.
I do get tired a lot. I don't have that much energy.
Because you're not sleeping well. We said that right off the bat. You're having too much caffeine too close to bedtime. And then on top of it, every time you drink basically, every time you drink a cola, your sugar spikes, your insulin spikes, you get a little crash.
Recently, Amy had a serious health scare when she discovered a lump in her chest, which her doctor suggested might be due to excess caffeine.
I think that you drink too much caffeine, and that is why you have the tumor.
Hold up. None of that makes sense to me. I think specifically with caffeine, we've seen studies that show both a protective effect on breast cancer. Small, rare studies show that there's no change in breast density for premenopausal women like herself. So like, I don't buy that tumor or mass was caused by caffeine itself. I've just never heard of a case like that. Could it have contributed due to unhealthy lifestyle? Yes. But due to? No. Wow, that's a lot of cola. That's a lot of sugar.
Wow.
950 pounds of sugar is what you get in your cola each year.
I don't think that's understandable to the human mind, but they love it for the dramatic effect so they could stand in the backyard and be like, whoa.
What we see right here is you're already a pre-diabetic.
Okay, if this is a fasting blood sugar, the glucose range puts her in the pre-diabetic range at being at 115. Also, I'm very, very surprised that her triglycerides are so low. Triglycerides is what you would expect to be high in a person who has uncontrolled or poorly controlled sugar or a high intake of sugar, because the body stores sugar through triglycerides in the blood. But the pre-diabetic thing should scare her, because while pre-diabetes doesn't mean diabetes, it is curable at that stage. Once you become a diabetic, you're diabetic for life. Your risk factors change.
24-year-old Michael lives on meat. He averages up to 150 pounds monthly. That's equivalent to an astounding 1,800 pounds a year.
The real problem with overeating meat is your overexposure to saturated fats. If you're eating a hot dog, you're also consuming a lot of carbs. Not only are you overeating carbohydrates that have been bleached, therefore rapidly converted to glucose and then rapidly stored as fat if you don't eat it, you're also consuming saturated fat. So all of that ends up raising your bad cholesterol numbers, your triglycerides, puts you at increased risk for heart disease, stroke, anything with cardiovascular conditions.
In one day, Michael can put away as much as 5 quarter-pound hot dogs, a rack of ribs, 2 steaks, and up to 30 chicken wings.
Red meat is a maybe carcinogen. Like, it's still not all the way there. It's like suspected, but the ones that are suspected are the processed meats, like the hot dogs, like the chicken wings. So you want to avoid those and eat those, like almost get rid of them totally, but occasionally if you're going to a football game and you have a wing, to me, I think that's a reasonable balance.
I'm a licensed psychotherapist specializing in eating disorders and addictive behaviors.
JJ Virgin. I'm a certified nutrition specialist and a certified health and fitness specialist. This is a ridiculous amount of chicken wings.
I don't like the confrontational nature right away. You can't come into a healthcare encounter with that kind of attitude and hope for good outcomes. You're setting up the encounter for failure right from the start when you come in judgmental like that.
So this would be dinner. 2.5 pounds of meat right here.
2.5 pounds of meat is a lot of meat. When we're talking about a portion of meat, it should be around 6 ounces, really, like a fist amount.
That is 1 month worth of your meat consumption.
Where is this? Where is this being filmed that they just jammed all of this meat in there? Outside of being a cool visual for TV, I don't know how this helps change his mind. Like, if I'm him, I see it and go, okay, and?
It looks good.
You think this looks good?
Yeah, that's what I was gonna say. Like, how do they think this would turn him off?
We see this AA-EPA ratio, which tells you the risk of heart disease.
What is this that they're looking at? This is an anti-gliadin immunology blood test that tells you whether or not you have antibodies to gluten. What does this tell him about his meat consumption? These are not the lab tests that I would show. The test I would show him is his LDL, his triglycerides are gonna be quite high. Having really elevated triglycerides puts you at a risk for pancreatitis, which could be a life-threatening condition requiring an ICU stay.
You're 24 with high risk of heart disease.
Yeah, what she was saying and what they were showing all make no sense. Her actual statement is fine. He is at higher risk, but not for the reasons that they just showed.
Victor lives on cheeseburgers and cheeseburgers alone.
Oh no.
Love burgers.
He eats 4 burgers a day, 28 each week, which is nearly 1,500 burgers every single year.
It's meant to be fast food, to be on the go every now and then, not to be something that is your primary meal. And if you develop type 2 diabetes because of the diet that you're following, one that is high in fat, high in sugar, what ends up happening is you have a high risk of stroke and heart attack, yes, but also high risk of developing problems in your eyes leading to blindness, peripheral neuropathy, where you feel pins and needles or even lose sensation in your fingers and toes. And that becomes such a problem that you might have a rock in your shoe that you don't even feel, and then it leads to a terrible infection that leads to an amputation. Like, think about the cascade of events that was to happen just from overeating burgers your whole life. Again with the cool visuals. I could see them in the producer's room. Let's get cartons of burgers and shove them in the trunk and open them! Ah!
29-year-old Eric of Cincinnati, Ohio, is addicted to French fries.
I eat basically just French fries.
You can't grow up to be a functioning adult just eating potatoes and French fries. Like, you need vitamin D. Rickets is a legitimate concern for people who don't eat or consume enough vitamin D. Calcium.
I'm very active. I skateboard once a week, if not twice.
Because of his athletic lifestyle, Eric hasn't become overweight and doesn't think French fries are damaging his health.
The way you look and the way that your body's functioning is not the same thing. My cholesterol video that I made talking about my blood test results, I was losing weight because I wasn't eating a lot of calories, but the quality of the foods that I was consuming was leading for my cholesterol to creep up, go real high, and therefore put me at a higher risk for having a stroke or heart attack. I may have looked great, my abs may have been coming in, but that didn't mean I was healthy. Weight is an important factor of someone's health, but it's not the sole determinant of someone's health status.
Eric needs a dose of shock therapy to really come.
Oh yeah, that's what he needs. Shock therapy.
French fries, starch, salt, fat. This is the worst type of fat that you can possibly eat. It's trans fat.
Yeah, trans fat is a big problem, and in some countries and parts of actually the United States have outlawed or reduced the amount of trans fats that can be in foods. Initially, trans fat was added to our foods in the 90s, but then we realized that it truly does spike your LDL, your bad cholesterol, and lower your HDL, your good cholesterol. So it's like a doubly negative effect on your health. And we saw rates of heart disease just absolutely skyrocket. Now, that being said, very important point here, just because something says no trans fat on it doesn't mean it's a healthy meal.
We wanted to show him the amount of French.
We need to show the fries! Get the boxes of the fries! Forklift! Truck!
This is LDL cholesterol. It's the worst kind. And that's what this elevated number is right here.
LDL, being 110, is slightly elevated for him. So it's not even that high. But a 110 is not nearly something that is scary. Very surprised. These blood work results are very suspicious to me. That he doesn't just eat French fries, or he's a very unique anomaly.
Daniel has been obsessed with raw meat for the past 6 years. He feeds his habit 4 times a week in pound after pound of raw beef, eating whole steaks pulled right from the packaging.
If you look at cultures like the Inuit, they were quite healthy and they ate primarily raw meats. They didn't even eat that many vegetables because they didn't have it. They lived in the Arctic, in the tundra. But what they did eat was the entire animal. So they got fiber from the parts of the animals that we no longer eat. So there's a lot of problems when people try and look at what other cultures do without fully understanding exactly what they do and how they do it.
Even raw chicken.
Can somebody say salmonella?
I have never gotten sick from eating raw meat, ever. And I've been doing it for 6 years now.
It just takes one time to get really sick, to get ICU hospitalized, to potentially get a colitis so bad that you need a colon resection and then need to wear a colostomy bag, to realize that, wow, I probably shouldn't have been doing that. I, as a doctor, can't tell this person what to do, nor should I tell this person what to do, nor should I judge what this person is doing. But what I could do is tell them the risks of what I just said, and then see if, like, are those risks acceptable to you? And if so, why? And if the person is cognizant and they can understand and accept those risks, that's it.
You do have a parasite
So this looks like they gave him an ova and parasite test of his stool sample, and they saw that there's a parasite, but they didn't do a taxonomy, so they don't know what kind of parasite it is. And it very clearly states there that there's no treatment that's even necessary if the patient doesn't have symptoms or other inflammatory markers. That's an important note there. Something else I want to point out is if you eat undercooked meats quite often, you put yourself at a risk of developing a tapeworm. Undercooked pork can lead to a cyst-forming parasite that can actually lay cysts in your brain. You're risking all these things for no real benefit. Like, just cook your meat somewhat.
One more thing that's of interest on this test, rotting protein that hasn't digested sitting in your gut.
They need to stop ordering these tests that mean absolutely nothing. Like, this show is so ridiculous.
34-year-old Nikki loves to eat cornstarch all day long.
Cornstarch is really nutritionally empty. Calories from carbohydrates, that's it.
Cornstarch is normally used for thickening, baking, but me personally, when I buy it, it's strictly for eating it.
Interesting.
My first craving for the cornstarch started when I was pregnant 16 years ago. Most women, when they're pregnant, they normally crave like pickles and ice cream, things like that, but my craving was cornstarch.
There's a condition called pica that basically creates cravings of eating all sorts of things. I've seen patients eat mud, dirt, sand.
My son, Marquise, he was 4 years old. He passed away 4 years ago due to a seizure. Since Marquise has been gone, I did start eating cornstarch more than I normally was.
There's some kind of psychological coping mechanism going on here. People find pleasure and safety in all sorts of aspects of life. Sometimes it could be a safety food that reminds someone of how they felt during a safe moment in their lives.
Oh, hi there.
What you got there? Whoa!
There was absolutely no need to catch her like that. That's so ridiculous and so obviously staged and getting me so obviously angry.
It's like smoke everywhere.
Oh,
I'm a psychotherapist specializing in disordered eating and addictive behaviors.
I'm JJ Virgin. I'm a certified nutrition specialist and a certified health and fitness specialist. How often are you having bowel movements?
Maybe once a week.
Yeah, that could be as a result of not hydrating enough or perhaps having low fiber. Again, you can't jump to that conclusion without doing a full evaluation of the patient. And I'm sure the show will do just that.
JJ and I pulled the cover off this pool to reveal the amount of cornstarch mixed with water that Nikki eats in a year. This is 1.5 feet deep.
These visuals piss me so much off. I just refuse to believe that there's evidence saying that if you show someone how much they eat in a year, it has any impact on their behavior.
What do you think's gonna happen if I walk on this?
Sink.
Are you asking that genuinely?
Wow.
If you walk fast, you can walk right across it.
And I don't understand how this is valuable to her journey at all, but I completely understand why the producers thought it was valuable for their show. So you know who this show is out to help.
Are you ready to see and experience what 6 months of your
Oh my God.
looks and feels like?
Are these people legitimate medical professionals that they're doing these things to these patients? Like, this is so ridiculous.
What?
Whoa.
It looked like a volcano had erupted.
Whoa, so cool. It's like a scene straight out of Breaking Bad.
You're goddamn right. What Nikki was really needing was support and somewhere to go with her sadness. I don't want her to go to cornstarch. I want her to go to her husband. If we take away cornstarch, we gotta add something. And what we need to add
is you running on cornstarch and losing your shoes and then going into an attic and spraying it everywhere.
Is the strength of this marriage is you being able to go to your husband.
When you're hurting, I'm hurting too as well. You have to let me know. You have to be open to me as well.
I'm obviously joking. This is good communication between partners.
I recognize that Nikki's gonna have a craving for cornstarch for a while, and I think tapering is gonna serve her better. We made a healthy rendition of her cornstarch by adding protein powder and fiber powder into it.
At least you're getting some better macros in there with the protein powder.
By day 3, Nikki's urges to eat cornstarch are growing stronger.
But when I do have that urge for cornstarch, I just go to my mixture with the protein and fiber.
This is where the therapy would be very supportive. Instead instead of just throwing it on the husband and saying, you solve it every time she's having these emotions. Like, I hate these fake therapy things on TV because it's so disingenuous of how it actually happens. In a situation like this, she would meet with a medical professional who's gonna try and explore why she's having these cravings. What is she thinking about during these cravings? What triggers the cravings to come on? And find actual ways to deal with those situations instead of sitting and making her run across cornstarch with water and then having her sit with her husband and have a great scene for television. Actually help her with mental health counseling. Show what it's like.
Kate's a devoted mum who loves to spend time with her family, but behind closed kitchen doors, life is no walk in the park. Because Kate's diet is almost exclusively cheese.
Not gonna lie, that is my dream. I'm like a little mouse when it comes to looking for cheese.
Because I have that memory of eating it from being a little girl, it's so safe. So I know that I can tolerate it and eat it and it won't make me sick or it won't make me feel uncomfortable.
Well, the thing with cheese is it absolutely can make you sick, even if you don't have a lactose issue. There's all sorts of bacteria that can build up in cheese. Listeria is a common one. And there's been a lot of conflicting data coming out on cheese on whether or not it helps decrease cardiovascular risk or increase cardiovascular risk. Are you getting good benefits from the micronutrients plus probiotics, or are you getting more harm from the saturated fat and overconsumption of calories? It really probably is going to depend person to person.
Sadly for husband Jeff, Kate's fear of anything hot and saucy means his home-cooked specialities are her worst nightmare.
Oh, I wonder why.
If Jeff's cooking something, he'll say when it's done, are you going to taste it? And then as it gets nearer, I can feel myself getting really, really anxious.
I wonder if this is some kind of phobia that you can perform maybe guided desensitization on to help decrease these physiologic responses that she's having of nausea.
I'd like you to go and grab one of those suitcases for me, please.
Okay.
Where's she going?
And then unzip it and then tip out the contents.
Oh, cheese.
That represents
how much cheese I eat.
In what sort of time frame?
A year.
6 suitcases worth of cheese is how much you're eating in a year.
What is one supposed to do with that information?
Pixie wants to show her the internal effect of her stodgy diet. She's got 10 meters of tubing, half what's inside the average person. She's prepared 2 liquids. One represents fiber-rich food and the other, Kate's cheesy diet.
Well, that's another good thing to point out, that cheese is usually not rich in fiber. We know fiber to generally be considered a healthy nutrient that you want to make sure that it's present in your diet in order to decrease potentially some risks of disease and slow the absorption of foods and to make you more regular.
I want to get you to transport the fiber-rich food right through the intestine for me. Now, what do you notice about that?
It's running down quite quickly, no problem at all.
Can I get you to do the same thing with the cheesy stuff? Oh.
This is so not accurate of what happens inside of our stomach. It's not just a bland pipe. Our GI system actually exhibits a neuromuscular function called peristalsis, where it literally through waveform motions of the gut pushes food along the track. So it is more absorbed and it does move freely. This is obviously just like a silly example.
Head chef Steve Hildebrand has been lined up by Natalie to demonstrate to Kate that the pasta she's terrified of is actually made up of ingredients she's already conquered.
This is this desensitization that I was talking about. This is one way of accomplishing a decreased physiological response to the food.
I'd suspect that that's the largest combination of flavors and ingredients you've ever tasted in one go.
Yeah.
Ever.
Yeah.
I mean, exploring your palate is generally a positive thing to do because when it comes to eating in moderation, that's usually a healthy strategy.
The floating city of Venice is home to some of Italy's finest restaurants.
Can I have the spaghetti with meat sauce?
Wow.
Thank you.
And I'm not gonna judge the food choices she's making because that's not my place. The point I wanna make here is that she's incorporating new foods that have different sources of protein, that have different micronutrients, perhaps some more fiber. Therefore, she's gonna get a more well-balanced meal and have a lower risk of developing a nutritional deficiency. Back to the show in just a second, but first I want to tell you about True Classic, a clothing brand that actually fits me. Online shopping for clothes is difficult because most stuff just doesn't fit right. And as a full-time doctor, YouTuber, and dog dad, I just don't have time to go to the mall and shop around. Fortunately, I found True Classic, and now my closet is full of shirts that actually fit my physique. They're a little tighter around the arms and chest to show off those gains, and a little looser around my midsection to make them super comfortable. I literally wear these shirts everywhere, whether I'm out to dinner with friends, at the gym, or even on stage during my presentations. It's not just t-shirts either. They sell long sleeve Henleys, jeans, button-ups, joggers, a ton of great gifts for the guys in your life. Upgrade your closet and shop now to unlock big savings during their huge holiday sale of ultra comfortable, perfect fitting essentials. Just go to trueclassic.com/Dr. Mike to save. Let them know I sent you. All right, let's get back to the show.
26-year-old Daniel drenches all his food in maple syrup.
I got my syrup going.
I put maple syrup on everything that I eat. Breakfast, lunch, and dinner.
It's gonna be a surefire way to increase the sugar content of anything he's eating, which if he's even remotely over-consuming calories in his meals and then adding that on top of it, you're gonna get into a place where you're gonna be putting on weight. And that's the unhealthy type of weight, where the odds are that you're gonna be putting on visceral fat, which is the fat that surrounds your organs and is considered less healthy.
Each and every day, Daniel downs more than 2 cups of maple syrup.
Wow, that's a lot.
That amounts to nearly 2,000 calories a day.
That's how much an average adult should be really consuming, period. And he's just doing that with the maple syrup. And it doesn't look like he's using a high quality maple syrup, which to me doesn't really reflect the true nature of maple syrup, where if you truly tap a tree and get the maple syrup out of it, you're gonna get some nutrients, but in these hyper processed ones, a lot of times what you're gonna get is just processed junk, refined carbohydrates that spike your blood sugar, spike your insulin, create all sorts of unintended, unhealthy effects.
His eating habits are catching up to him. He's not as active as he was. He's not as energetic as he was. The maple syrup is taking its toll on his body.
Yeah, when you're gonna overconsume the maple syrup, what's gonna happen is your body's gonna store the excess sugar as triglycerides. It's gonna deposit itself in your liver. You're gonna have insulin spikes. You're gonna see hormonal changes. And most importantly, you're gonna see body fat increases. And when you start carrying excess body fat, your risk of heart attack, stroke, cancers go up. It really is a detrimental effect on the human body.
This maple syrup here, how long does this last you?
About 4 to 5 days.
Sounds like it's your drug. Sounds like it's...
I won't go that far, sir. I don't even know you, and you shouldn't even talk to me like that, you know?
Yeah, I agree. Even though it's unhealthy, the way this person's talking to them is a little aggressive. Part of having a good physician-patient alliance is being on the same page. And you did not start that conversation off on the same page.
Oh, my Lord.
We used a storage container to stash 912 pounds of sugar, 2 years worth of what he's eating. Yeah, so 2,000 calories a day of sugar that you're downing.
Who talks like that to a patient? The food that you're downing. Who are you?
It's a lot of syrup.
We've set up 2 years worth of Daniel's maple syrup.
No, what you should be saying is we wasted 2 years worth of maple syrup to set up a stunt for this camera.
We actually want you to pour every single one into that trash.
In the era of wasting food, this is so terrible.
I don't know why you guys are wasting this much syrup. That's crazy.
It's trash.
No, it's not. It can totally be used as a sweetener appropriately. Overconsumption of it is unhealthy, but the judgment that's coming from these supposed 2 mental health professionals and nutritional specialists is really upsetting. I would have loved to see the mental health specialist, this Dr. Mike character, step in and say something about this and call it out that this isn't healthy.
The real shocker came when I looked at his body composition. You have 42 pounds of fat on you.
She says it so judgmentally, it's insane. 42 pounds of fat, like what does that mean? Give me a body fat percentage. That's the real value of what I want to know. And that's a body impedance scan. They're not super valuable. It's slightly better than, let's say, just doing a BMI for the average person.
You should be sitting there, honestly, 8-9% body fat.
Excuse me? Excuse me. 8-9% body fat? What is he, a bodybuilder?
I gave Daniel this information and I think he heard it, but I wanted him to really feel just how out of shape he really was.
I'm gonna make you feel terrible about yourself, and that's gonna help you get better.
Come on, up. That's good.
When JJ made me do sit-ups, I knew that I have a problem.
They're forcing him to say that.
Daniel didn't even make it a minute. He was sweating, he was struggling.
That's what exercise is, since you've clearly never taught anyone exercise.
That is peach salsa.
That is good.
Now Daniel has some alternatives that have 1/8 of the sugar of his maple syrup that he can use to push maple syrup out of the way.
Well, that's a good alternative. I'm okay with that. That's making progress in the right direction. At least it's a little bit of a practical step that he can use, as opposed to, hey, you suck at exercise.
We wanted to show him somebody who was young, who had kidney failure, and now he spends 3 days a week, 4 hours at a time at this dialysis clinic.
Mikey, how old are you?
I'm 36.
Why does Mikey have kidney failure?
We wanted Daniel to understand that by the time he started to feel bad, it could be too late for him.
Are they saying he's gonna develop type 2 diabetes and then not control it with medications and then develop kidney failure? It's so much to the point where he ends up being on dialysis? I mean, this is so strange.
Danny, you look a little freaked out.
I don't want to see this.
The sooner you can make a change, the better.
This is so awkward and wrong.
I could be in this situation a couple years from now. I don't even know how I would adjust to this.
Why are they shitting on this poor guy's life? We don't even know why he has kidney failure.
Daniel, when we met you, you were eating a gallon of maple syrup a week. How much are you eating now?
Quarter at least of a gallon.
Daniel has cut down his maple syrup consumption by 75%.
That's moving in the right direction for sure. They're such assholes though.
36-year-old Misty drowns everything she eats in tartar sauce. Every meal, every day.
This show feels so exploitative? Exploitive?
Exploitative. Exploitative.
It's so bad that it's both.
In just tartar sauce alone, Misty consumes a mind-boggling 14,000 calories a week.
That's a lot of calories. That's 2,000 calories a day. People think that this is a physical issue, but it's actually a mental health condition that's driving her to feel this way about the tartar sauce.
Eating tartar sauce is almost like having an orgasm.
Wow. I've never heard anyone discuss tartar sauce in that way. Tartar sauce isn't even considered an aphrodisiac. Not that any of those aphrodisiac things, by the way, make any medical sense.
Tartar sauce in your purse, Misty, really?
I don't know how they got there.
Open that truck.
They have to do the visual every episode.
Oh,
there's another one.
Wow.
Oh, I thought they were gonna fill up the truck with tartar sauce.
For real?
Yep, for real.
People have legitimate medical issues, and this is how they treat it.
We're gonna send a year's worth of tartar sauce rushing towards you right now. Are you ready? Here it comes.
This is so sick.
Just to see all that ooze and goo sliding down the slide, it even grossed me out.
It's all the fat in that tartar sauce.
This is, ooh, no.
If there was a shortcut to creating an eating disorder, it's this.
What do you see?
Heavy-set woman.
You're obese and most likely at this point morbidly obese.
The fact that you say that with a scowl makes you a scumbag.
This could be as bad as it gets, but if you keep going. We had created a picture of Misty with about 50 more pounds on her.
Did they Photoshop her to be bigger? Are you trying to create a body dysmorphia? If I was in this producer's room, I would tear these people apart.
Tartar sauce is 74% fat, while the Greek-style yogurt JJ is using is only 2% fat.
I want you just to taste it.
Okay. When I first tried the Greek yogurt, it was disgusting.
Greek yogurt unflavored is not for everybody, but it is a good substitution for tartar.
Just the base. We're gonna experiment with a bunch of different tastes and we're gonna find a couple things that you like.
Substitution is good. This is the one part of the show that I'm not angry about.
Misty is ready to share her new sauce choices with her daughter.
This is real good. This
is the one positive thing about this show.
Yogurt and the spicy brown mustard.
That's why like spices are really great in that they usually don't add calories. Some spices don't even have sodium content. So as the product and the creators themselves. Logan and Jimmy were quick to push back on the critics with their own posts, and in the process created newsworthy headlines like,
YouTube stars are coming for your kid's lunch. It's a move that has Mr. Beast, Logan Paul, and KSI teaming up to take on Lunchables.
And I usually don't make videos discussing creators' products, but when terms like healthier or better for you get tossed around around, I feel it's important to set the record straight. So, in the spirit of avoiding personal attacks, let's take a look at the science of Lunchly, including a true issue with their kits I don't think anyone has correctly pointed out yet. For those who may not know, Lunchables are basically these pre-packaged do-it-yourself meal kits. They've usually got things like crackers, deli meats, cheeses, treats, and come with a little drink. And since their inception, they've been super popular with kids. However, it's been known, especially by experts, that while these kits are fun and tasty, their nutritional value is just not good. They're often too high in sodium, saturated fat, and added sugars, and don't use healthy whole food ingredients. And because they fall into the category of ultra-processed foods, they aren't healthy to consume often, period. Studies actually show that those consuming high amounts of UPFs can have up to 50% higher risk of developing obesity, and some specific UPFs are linked to increases in cancer. I see it even in my clinic. So many of my pediatric patients are over-consuming UPFs, and it's becoming a growing problem across the country. Consumer Reports even dedicated a special feature highlighting the problems with Lunchables and why they shouldn't be consumed regularly due to health risks. My own take on Lunchables, I don't recommend parents pack them for their kids on a daily basis. A low quality food with poor nutritional value. But now what about Lunchly? Starting with the first claim, in the press release announcing the product, Logan Paul was quoted as saying Lunchly is a healthier alternative and that it's a better for you lunch option compared to Lunchables. In fact, throughout the Lunchly website and the social media promo posts, you'll see countless comparisons being made to Lunchables. To be honest, some of the comparisons are kind of cringe and don't make much sense to me, but maybe that's because I'm not the target demo. Flavorful combos versus standard picks? The meal kit combos are nearly identical to Lunchables. Big gestures versus mid moments? I certainly don't remember that lesson in my nutrition classes. I was more concerned with the nutritional comparisons being made anyway, so if someone was to make a healthy meal kit for kids, I would find that incredibly valuable. And in looking in the comparison, I'd be most interested in calories, which they have, protein, which they have, sugar, which they have, saturated fat, which is missing, and sodium, which is not only missing, but replaced by electrolytes. And unlike all the other macros, is only labeled potassium and only in the Prime bottle in the kit, comparing it to the Capri Sun in the Lunchables. This is a pretty weird marketing choice to label electrolytes in food products. It's such a strange choice that it even stunned fellow doctor Brian Suterer, who tweeted,
"Sodium getting rebranded as electrolytes will be taught in marketing textbooks one day."
And then sadly, it was a shame to see Logan attack instead of starting a meaningful dialogue with the doctor, given that 400 milligrams is not the amount of electrolytes in Prime, at least in the image that Logan shared. 400 milligrams of potassium plus 5 milligrams of sodium equals 405 milligrams of electrolytes. It's not about nitpicking, it's just about being reasonable and honest to help further the conversation. Look, if I want to decide if a food is right for me, I like to be able to compare the entire electrolyte profile, which would have to include sodium. It's like having a PB&J sandwich label that says what's in the sandwich, protein, fats, calories, but then the sugar line only tells you what's in the peanut butter as opposed to the jelly in the entire sandwich. I wanted to go further and do the comparisons myself using the nutrition facts from the Lunchables and Lunchly websites, and it's honestly really hard to draw perfectly clear conclusions for several reasons. One, I don't have nutrition facts for each part of the kits. For example, how many calories come from Feastables versus the food component. Second, some of the portion sizes aren't the same. The turkey cracker kit from Lunchables is 82 grams, while Lunchly's is 72 grams. 3, there are so many varieties of Lunchables that just swapping out the flavor of Capri Sun caused significant differences in sugar and calorie content. What I was able to conclude is that Lunchly has less sugar and therefore less calories than Lunchables in comparable kits. That's probably due to the drink component of the kit, as Capri Sun uses sugar and Prime is artificially sweetened. Lunchly has significantly more potassium than Lunchables because of the Prime drink, which I guess is good, but not something I'd regularly use in deciding if a food is an ideal lunch for a kid. Lunchly has slightly less sodium and saturated fat than comparable Lunchables. That's definitely moving in the right direction, however, both differences were fairly small. Lunchly does use real cheese as opposed to cheese product, signaling that at least one ingredient is less processed than in Lunchables, but the entirety of the kit is still considered an ultra-processed meal. Lunchly has higher amounts of A and B vitamins, which can be good, but also can be problematic as vitamin vitamin A is a fat-soluble vitamin, and kids can easily overconsume it, leading to toxicity. Being that it's fat-soluble means that you can't just urinate excess out. This has actually been raised as an issue by experts with Prime in general. Despite these legitimate upgrades, social media posts are slamming Lunchly for not being perfect. But Lunchly does not need to be perfect to be valuable for kids. It just needs to be significantly healthier in order to reduce risk. As a doctor, I use risk reduction all the time, essentially taking something harmful and replacing it with something less harmful, but still imperfect. As an example, I would never recommend starting vaping, but getting someone to replace smoking cigarettes with vaping is generally a good step down in terms of health risk. Knowing all that, is it fair to say that Lunchly is healthier? I guess one can say yes, but honestly, probably more so as a marketing tactic. The reason why? Well, let's look at the recently passed nutrition standards set forth by the USDA for school lunches and see how Lunchly compares. Going line by line here. Less than 10% of calories should come from saturated fat. Lunchly turkey, 23% of calories come from saturated fat. Less than 10% of calories should come from added sugars. Lunchly turkey, 10.4 comes from added sugars. But this is where things get really interesting, and for some reason no one has pointed this out. You see, USDA caloric guidelines say that a lunch meal for kids K through 8 should contain around 625 calories. Kids need energy to function, and calories give them that energy. Lunchly turkey contains only 230 calories, which would mean a kid would need to eat about 2.7 portions to consume enough calories. And if they did that, they'd get nearly 1,300 milligrams of sodium, which is also significantly over the USDA standards. So they'd be either under-eating calories or overeating sodium. Finally, the grain guidelines state that 80% of lunch meals must be whole grain, and Lunchly turkey does not list any whole grain ingredients. It's clear Lunchly, just like Lunchables, misses the mark too many times to be considered meaningfully healthier, at least in my opinion. That being said, I do think many criticisms pointed at Logan, KSI, and Jimmy are unfair. Attacking them for trying to create a successful influencer product isn't inherently problematic. I just think if a company was truly interested in creating a healthier lunch kit for kids, the USDA standards should be the minimum starting requirements. Otherwise, we're simply propagating the problem even further. One of my hopes is that in navigating the future feedback on this company, the guys hire a health professional to guide them in making messaging more accurate. I just saw someone ask about heavy metal contamination, and Logan responded with a video of an X-ray machine checking for foreign materials. That checks for stray objects accidentally getting into the meals, not heavy metal contaminations like we discussed earlier with Lunchables and lead. And saying a food has more electrolytes, therefore it must be better or healthier, is just not true. Foods with an incredibly high sodium content and electrolyte are not considered particularly healthy. In fact, many are considered unhealthy for that reason. But
not enough. Her heart's failing due to the extra strain.
So pulmonary hypertension is exactly what it sounds like. Pulmonary meaning lungs, hypertension meaning high blood pressure. But it gets really tricky when you have high blood pressure within the lungs, because then it puts a lot of strain on your heart to be able to beat against that pressure within the lungs. Oftentimes, once medication fails, the last approach becomes surgical intervention, which is what I expect to happen here. When I say surgical intervention, it means a transplant.
What about a fix?
Isn't it just a transplant?
Nope. There's nothing inherently wrong with Melanie's heart. It's healthy. Just needs a little bit of help. So we're going to leave her current heart inside and slot in another one to support it.
Well, it's still a transplant. You tricked us, man. I obviously don't take surgical cases like this. This is outside of my wheelhouse, but it is interesting to hear that this is even a possibility. You can have two hearts beating simultaneously to give it a little bit extra support. You probably would have to be on blood thinning medication, immunosuppressive medication, because you have more turbulent blood flow. You have another organ inside of you that your body will probably react to unless you have immunosuppressive medication on board. I can see a huge challenge coming up here.
Do you live in a tent? Yeah. I lived in a tent too. It wasn't very good, so I moved to a bus. You should move to a bus. You will be much less likely to develop ulcerative tinea pedis. Tinea
pedis, or pedis as he says it, is a fungal infection of the feet. When it becomes very severe, you can have ulcerative fungal infection, where you actually have breakages in the skin and you can get infections on top of the fungal infection you already have present. It's basically like the worst form of athlete's foot. Treatment for this usually requires oral antifungal medication because topical would not have enough strength to cover it.
Just keep it dry and clean and we'll give you some.
Would you rather we continue to discuss this inside? We are discussing things with the patient that are potentially sensitive.
We're done with the patient.
He's actually really right here, even though the fact he's usually bad at picking up social cues. You should not talk about sensitive issues in front of other people with a patient like this. Even if it's as simple as putting up 2 little curtains to give them some privacy, or at least a sense of privacy, will make the conversation go a lot smoother and allow the patient to take in the information without feeling like all eyes on them. Good job, Sean.
Excuse me, please. Excuse me, please.
Thank you for keeping me waiting.
We doctors are busy, important people.
Hold on a second. Is that Dr. Cuddy from House? Is this like a crossover event that's happening right now?
Look, Dr. Blaze, I am like any other patient, entitled to have a say in my own treatment, but unlike any other patient, I have spent my entire adult life digging into people's brains. So if you think I'm gonna sit around and watch, you're mistaken.
Well, if you think you can operate on yourself, I'd happily add you to the list of potential surgeons. Today, you're going to be waiting. And waiting. And waiting. Test, test, test. You've had them all before. I want them again. My versions.
It's actually really important what she's doing here is that she's not letting herself be bullied into making medical decisions based on just what he wants. She's letting her own clinical experience, her knowledge guide her to make the best decisions for his health. Very often this happens when you have a powerful patient, a VIP patient, someone very wealthy, that they say, oh, I want the absolute best care, I want all the tests, when in reality, that's not in their best interest. And it takes someone with a lot of guts to stand up to that. So I applaud Dr. Blaze / Dr. Cuddy.
What's your name?
I'm Harry. These are my meds. Those pills are for people with chlamydia, Harry.
Oh, you're all the same.
See, I know better. That's why I had to hide out in the streets. I had to move next door to Mr. Googly Eyes. I trust him. He's my friend.
Why are doctors involved in this and not security staff? Like, if I'm going to any kind of event, they usually bring security with us because there's a lot of medical equipment here, there's medications. Why are the doctors getting involved? Come on, show, get some diesel security dudes and gals up in there just
I trust him. Okay. Disorganized thinking, paranoia, and delusions. I think you have schizophrenia, Harry.
Okay, this is my first time I'm gonna call BS on Dr. Sean. As a surgeon, perhaps he can look at someone and figure out the problem right away because it's a problem of plumbing, anatomy, what have you. He can look at a scan. You can't treat humans with mental issues like that. Say this patient is just high on methamphetamine and he's having all of this disorganized, psychotic thinking. Is it schizophrenia? No, it's not. So Dr. Sean, pump those brakes and let a non-surgical doctor take over here. That's an abscess.
That smells very bad.
So the reason why abscesses smell bad is because you have an infection that already smells bad, but then you have all these inflammatory cells that go in to fight off the infection, and what your body does is it walls off that infection and essentially creates a bubble of pus. And pus never smells good because of the dead bacteria. The only treatment, IND, incision and drainage. Cut that bad boy open, let it drain out, get the infection out, and then you could start thinking about antibiotics and all that. But you have to drain it.
This will give me at least 10 more years.
Should give you 10 more years, yes. Elliot, I understand your concerns, but
And Dr. Melendez is one of the best cardiac surgeons around. Dr. Andrews told us all about you when he convinced me to come here for surgery instead
you
of...
spoke to Dr. Andrews.
And they've both already spent half the morning raving to the press.
Well, that's very kind. You spoke to the press? You spoke to the patient, my patient.
As I explained to Elliot and Melanie, the press attention is a necessary element for funding this surgery.
There's a fine line with doing this type of press and exposure. And I understand that line very well because I try and balance my professional life as well as my life as a social media person very diligently, to put it nicely. Sometimes medical systems forget about that line. They forget about that the major mission that we're involved in is helping humans. And while yes, we want to get a better surgical center so we can help more people, we want to create funding for our hospital, notoriety for our hospital. The question needs to be asked is, at what cost? Did we discuss this with our patient? Are they on board with having this type of press happening? Is this fair to them? Are we taking advantage of them? And only until you answer those questions, only then you can go ahead and do all this press and notoriety for your hospital. Oh my God, is he having meningitis?
It's stiff. A stiff neck could be an early indicator of bacterial meningitis.
There are many possible explanations for a stiff neck, most of which are much more likely than bacterial meningitis.
If the abscess has invaded the meninges of his brain, it could be exacerbating his paranoia.
So bacterial meningitis is inflammation of the meninges, the soft little padding that's found between your brain and the skull. This is quite dangerous because the area inside your skull is very limited, so that if you increase pressure, you could actually harm the brain and do damage to the brain. On top of that, that infection can spread from the meninges to the actual brain, to your blood, and cause you to become septic. It's a very dangerous condition that needs to be treated urgently. The way you diagnose it is you go into the spinal cord through a lumbar puncture, and you see and you study the spinal tap. So you see if there's white blood cells there, if there's bacteria in there, you do a culture, if there's blood, and it basically points you to if there is a meningitis, what could be the possible cause of it? And then right away, you gotta start being as proactive as possible, starting all the treatments and backing down once you have the guidance as to what the likely cause of the meningitis is.
Hey.
Melanie has an aortic aneurysm. 2 hours beating into that.
Yeah. Not so good.
So I've talked about aortic aneurysms on this channel in the past, but basically what happens is the aorta is the major blood vessels that comes out from the heart that allows it to bring blood to the rest of the body. If you have an aneurysm, you basically have a weakness within the wall that allows ballooning of the last layer of the artery, which means what? If you have more pressure, meaning 2 hearts beating at the same time, you could actually rupture the aorta, and what happens? You bleed out internally and you die. Perhaps they can fix the aortic aneurysm first and then do the procedure. I don't know how critical this patient is right now.
It was my medical opinion that he could have bacterial meningitis.
And if you're right, then I owe you an apology. But if you're wrong, then I will be on the phone to Denver, and I will make your life infinitely more complicated than you think you're making mine.
Why is this such a manipulative situation? For God's sakes, there's a patient's life at stake who could have bacterial meningitis. You're saying if the doctor's wrong by playing it safe, you're gonna give them a bad review? I feel that one of 2 things is gonna occur. One, it's gonna be viral or aseptic meningitis, which can happen. Or 2, by bringing him in and doing all of these things, they're gonna find out that he has another issue that had they not brought him in, he would have passed. Let's see if my prediction is right.
Harry has kaleidoscopic disintegration. We thought he had
What?
schizophrenia, but he does not. He has a brain tumor.
This is why you send patients to the ER, because in the ER, with all of those symptoms, in addition to getting a spinal tap, they would have done a head CT and likely done it with contrast to see what's going on inside the brain and would have seen something like a brain tumor. But I don't know what kaleidoscopic disintegration means. Even if he's right with the brain tumor, this is a guessing game. This is not how medicine is practiced. Kind of ashamed to see this because in season 1, they were so medically accurate in making these diagnoses and how it happens. But here, just because he's finding some symptoms and he's getting these wild theories, did you do a drug screen? Did you see if he's anemic? Did you see if he has a major thyroid tumor causing excess thyroid hormone and that's why he's bouncing around all over the place? There's a lot of things that need to be ruled out, Sean.
Have you seen Harry? He lives in a... We need to find Harry. You don't...
So those who are diagnosed with autism sometimes have a condition where if there's overstimulation, whether it's lights, sounds, even stress, they can sometimes be overwhelmed like this. I totally sympathize with Sean, what's happening here, because he's trying to do the best for his patient, but clearly it's a struggle.
You have a neurological condition too, but yours can be cured.
I appreciate the sentimental value here, but he doesn't know that. What if it's a malignant tumor?
You just need some surgery, then you can be Edward Austin Thomas again.
You just need some surgery, just some surgery.
Knife.
Someone pay attention to the monitors on the show. She's flatlining there. They haven't even made the incision yet, and she's already flatlining.
Edward has a right parietal brain tumor.
Dr. Lim, you can have OR number 2.
That's not an emergency operation. When you need surgery, you can go one of two routes. You can go planned or you can go emergent surgery. For example, if you come in with a level 1 trauma where you got shot or cut inside your abdomen and you need to find the source of the bleed and shut that off, that's emergent surgery. You're not going to get a lot of pre-testing done to make sure the patient's capable to get through that surgery because they'll die otherwise. So you want to just do as best as you can in the given moment. But in this scenario, this is not urgent. This patient has lived for a while with this tumor and been fine. Perhaps it's best to do some pre-surgical testing, figure out if we can optimize them medically, meaning get them on some medications, lower their blood sugar, control their blood pressure, clean them up.
Now we just have to wait to see who wakes up, Edward or Harry.
See, that is realistic. There are certain tumors, depending on where they're found inside your brain, that can totally change certain aspects of the way you behave. For example, the frontal lobe is what's most important for decision making and control over your urges. So it's not uncommon for a patient who has a frontal lobe tumor to start acting differently, becoming more risk tolerant, meaning that they're gambling more, they're having more sexual relations, unprotected, cheating on their spouses, and then no one knows what's going on. Only until they get properly examined do they find out that they had this tumor the whole time. It's just like playing Surgeon Simulator. Just drop it in, it's all good. Heart.
Why don't you just give your skin something you already know makes you feel great?
Hydration? What are we talking about? Lifestyle changes? Sun protection?
Introducing new Diet Coke Biolay. The rejuvenating facial cleanser made of your favorite thing on earth.
Why are they washing their face with Diet Coke? It's not completely unreasonable. People do put caffeine in skincare. And then there's different acids in Diet Coke. I think phosphoric acid is in it. That is not the type of acid. Like in skincare products, you'll see hyaluronic acid.
Because I want my face to feel young. And I want another way to consume Diet Coke.
First of all, you're not gonna consume the Diet Coke. Your skin is not gonna absorb it. At least not like the way you expect.
Just don't shake it.
I liked my old facial cleanser, but I hated the calories.
You don't absorb calories through your face. The purpose of putting skincare ingredients on is to make the skin healthy and to give it what it already has in it, but maybe boost it. If your skin is dry, you want to put some moisturizing ingredients in it. Putting in caffeine, aspartame, not valuable to the skin.
Are you feeling tired and worn down?
Yeah.
Sick of the endless grind at work?
Yeah, reacting to SNL and memes really takes it out of me.
Then ask your doctor about COVID.
About COVID, I didn't expect that.
By simply getting COVID, you're guaranteed a 5 and sometimes even 10-day vacation from all of life's problems.
Oh, I hate to laugh at this, but now this is so bad. You could just socially isolate because you need a mental health break. You don't need COVID to expose you to all those other risks. You know, long COVID is a thing.
COVID isn't for everyone. That's why there's also new COVID Always Positive Home Test. The only COVID test that comes with 2 pink lines already drawn on.
People think that when they get COVID, they need to keep retesting. There's a world where for a little while you continue testing positive even though you feel better. So really it should be a clinical decision, meaning your symptoms should guide whether or not you're still infective. Infective? Infectious. Doctor.
After losing their first 3 quarterbacks to injury, Green Bay is turning to a 4th-string back who I've never heard of.
Jared Schleff has not taken a snap.
James Sprunt Community College.
He takes the snap.
Oh! PCL, God!
Folks, this is one of the worst injuries I've seen in my 40-year career.
Did they take off his limbs?
I think watching that made me sick.
Absolutely. No one should ever have to witness something that shocking. Let's see it again.
Let's see it again. Oh! I could just see the PCL going, the meniscus tearing.
This new angle is much better.
This is actually similar to what happened to Paul George the other day. He had a hyperextension of his knee like this.
Dr. Kavner, obviously a really tough injury for Schleff. Will he be back on the field?
Will he be back on the field with his legs facing the other direction?
I can't diagnose it because I couldn't really see exactly what happened.
Oh, you know what? We have it right here. Okay.
Mechanism of injury is the best way to make a diagnosis. So this doctor was on something when he said, I wish I saw it.
Oh, he's done. He is done forever.
He's done forever. You could rehab that injury.
All right, let's take a look. Whoa!
Yes, doctor? See something you like?
I already could see the positioning is off here. She would need to scooch down a lot more in order to have a proper view.
I used Glamgina. Makeup for your other face.
You know what's funny? There's actually a product, I think it's in like the Nordic market, and it really exploits a lot of insecurities women have surrounding their other face.
Did you give it a smoky eye?
I sure did. That's the magic of Glamgina.
Where are you guys coming from?
The parking lot.
There's also an issue with this because when they call it Glamgina, it sounds like vagina, and that's not where that product would likely go. It's not an insertion, it's a vulva product, and they're not being clear with that because vulva and vagina are two different things.
Lip plumping gloss. Side effects may include vaginal migration.
I don't know what migration means, but you could have bacterial vaginosis if you put the wrong chemicals down there.
All right, you know what? I'm just gonna give you an antibiotic shot, okay?
Antibiotic shot for what? How about you come to a diagnosis, fake doctor?
I have to know, is Glamgina hard to wash off?
Not at all. Just spray some Windex on it.
What is this, my big fat Greek wedding?
Somebody gave me the mati.
Put some Windex.
Oh, God.
Yeah, that's a very sensitive area. You don't want to put Windex there. Within the vagina, the environment is moderately acidic, 3.8 to about 5 pH. So putting things in there can impact that acid-base balance. A lot of companies will be very predatory in their marketing by making it seem like you need these products, when in reality, self-cleansing oven don't need them.
Whoa! Frank Thomas?
That's me. What's your name?
I'm Mark. I'm a huge fan.
Why do I feel like this is a Viagra commercial? They always use a home run hitting baseball player.
Let me guess. Lower drive? Can't get hard anymore?
Well, lower drive.
It's not your fault. Testosterone levels drop as you age. That's why you can't get hard anymore.
I didn't say that.
Well, testosterone levels are supposed to drop in your 30s by about 1% a year, but that doesn't necessarily represent why people struggle getting erections. That is certainly a sign of low testosterone, but in fact, I would say put it this way. If you take all the people who have erectile dysfunction, less than 10% of them are having erectile issues because of low testosterone, solely low testosterone.
Doug Flutie?
Yep.
Mark here just turned 40.
Let me guess. You can't get hard anymore, huh?
Bingo.
No.
He's not saying that.
What are you guys talking about?
Oh my God.
What's William Dafoe in it?
Sir Willem, I'm not even British. Let me guess. You just turned the big 3-0.
30?
Now, with Nugenics.
Oh, Nugenics.
What's Nugenics?
Honey, what's taking so long?
We're trying to help your husband get hard again.
What? Oh my God, aren't you?
Sir Willem Dafoe.
Why can I only think of him as the Green Goblin?
And you're even more handsome in person.
What the hell is that?
That's Nugenics.
What? So Nugenics is a machine?
Oh, so now he's interested.
I don't understand. Is it a pump? Is it a pill? What am I watching? Because there are injectables that do work for erectile dysfunction. If I had to make a diagnosis on the limited information I have available, I'd say priapism.
Nugenics, testosterone boosting male enhancement. Try it for free.
These testosterone boosters, every time I find out my patient's taking one, the way that I find out is not because they tell me or because it's in their chart. It's because I check their labs and I find that they have liver inflammation. We can't figure out why. They're on one of these weird supplements. Then we discontinue the supplement, the liver inflammation goes away right away. Back to the sketches in just a second, but first I want to tell you about Odoo, an all-in-one software that offers a range of applications for small and medium-sized businesses such as sales, marketing, HR, and my favorite, a website builder. While I spent a lot of time making YouTube videos, it's not the only part of my business. I actually have a couple of websites like professionalsmediaacademy.com for my course where I teach professionals how to turn their careers into a full-blown media business. My course would not exist if I didn't have a website that connected me with my customers, and that's exactly what you can get from Odoo's website builder. The builder is so fast that you can configure the entire thing in just a few clicks. And with their simple drag and drop tools, you don't have to have any technical skills to put together a sleek looking website in no time. The best part, it's free. When you sign up for Odoo, you can get your first app for free for life. Choose the website builder and that tool won't cost you a penny. Not to mention they offer unlimited hosting and support, as well as a free domain for your first year. For something that's essential to running a small business, I can't imagine a better deal. Click the link in the description to get started with Odoo for free right now. All right, let's get back to the show.
Fasting for Ramadan used to be easy, but the last few years with work and a growing family, it's felt almost impossible, but not anymore. Thanks to Ozempic for Ramadan.
Oh my God. For those who don't know, Ozempic is a GLP-1 agonist medication that essentially slows down gut transport, which makes you not hungry.
With Ozempic for Ramadan, I can walk into the mosque with a full heart and a 27-inch waist.
Bam! Ozempic for Ramadan. Yeah, it's just Ozempic.
I love that Ozempic can't sue them for this, because imagine the court case. And also, you gotta be careful when you're fasting that you stay well hydrated. It's very easy to get into a position where you're dehydrated, you faint, especially if you're operating heavy machinery or driving.
Good morning, folks.
Good morning, Dr. Fat Daddy.
Ooh, interesting name.
Please, it's just Fat Daddy.
What is happening here?
Before I became an OBGYN, I was pitmaster at Fat Daddy's Barbecue Palace on 78.
Oh, gosh, we love that place.
Mm-hmm, me too. Thank you very much. I'm proud of it. Yeah. All right.
Why is he mixing it?
All right.
Oh no, he's like turkey seasoning her.
Barbecue is just something that I know how to do. But my true passion is always been gynecology.
Why is he squeezing a lemon on her?
Nurse, why don't you take her temperature while I duck into the pit? All right. Let's go into the pit. Here we go. Hey, I'm going in.
Why does he have tongs?
I found him. Everything is all right. All right.
Unethical.
Now the baby, it's coming along. It's coming along real good. Yeah, it's just a little dry. That's all. But that's okay. I want you to make sure that you rotate them every week or so.
Rotate the baby. It's not a rotisserie.
I let it go for about another month and a half, 2 months. Yeah, it should be falling right off the bone then. Yeah.
Sorry, fall off the bone?
That's just medical jargon, girl.
That's not.
Also, I'm gonna say your pH is a little off.
You really shouldn't say that. Your hands need gloves on them. They need to stop entering your mouth. And what is happening on your white coat?
Are you sick again?
I'm sorry, honey.
You just got over the flu.
It is viral season, so.
You don't have to suffer through cold and flu season this year. Other flu medicines let you sleep for 8 or 10 hours. Hibernol lets you sleep through the entire flu season.
It's a bear supplement.
Unlike other medicines, which contain small doses of mild sedatives, Hibernol contains a powerful narcotic.
A narcotic, and he's chugging a gallon of it?
While you sleep, living off stored body fat, the cold runs its course. And in fact, other colds and flus may come and go.
Yeah, I was about to say, you're out for so long. Think about not moving for that long period of time. Muscles won't be as good. Your cardiovascular system won't be as good. You will get bed sores unless someone repositions you.
Hibernol. It knocks your cold out while you're out cold.
You know what's funny? A lot of people will take this cold and flu medicine that has an active ingredient called diphenhydramine. And while that may help you fall asleep, it might keep you sleepy throughout the next day. It can cause sluggishness, brain fog, pretty significant side effects that we didn't realize, at least I didn't realize early in my medical training.
From the makers of Comadose.
Yeah, Comadose, to help you stay comatose.
How are we doing today?
Oh,
Great.
just fine. Not so bad.
You're in here for a complete physical, is that right?
That is correct.
What about an incomplete physical? What is an incomplete physical?
When did you last have a physical?
About 5 years ago, I was in Seattle.
Oh, interesting. I have a brother in Seattle.
Oh.
Yeah.
People love doing that. Like you say something and then they say, oh, I know someone who does that. What do you do? Oh, I'm a doctor. Oh, you know, my cousin's wife once dated a doctor. Valuable.
It's a nice town.
Oh, it's a great town.
I hated to leave it.
That's not an accurate measurement. The beam has to be balanced in the middle. He's faking being a doctor, I can tell.
Will we step off here and just drop your pants?
Why does he ask him to drop his pants randomly in the middle of the room?
And cough, please.
That is not how we check for an inguinal hernia. What we're actually doing is palpating, notice I used the word palpating, to see if there are contents from the abdomen that are protruding out of the inguinal canal when you ask a patient to cough. And it's also very important that you ask the patient to turn away so they don't cough on you.
Oh, hold on.
Oh, no, don't worry. This is my associate, Dr. Walt.
When we have a room that opens while a patient is undressed, we have a drape around the door so that if someone opens, not everyone in the hallway gets a first-class ticket.
Is there some problem?
One more time. What do you think?
It's tough to say. Cough, please.
What are they doing to this poor guy?
One more for me.
Now for me.
They can't both check for inguinal hernias at the same time.
Nurse, see if you can feel this right. Go ahead and cough, Mr. Harris.
I see.
Mm-hmm.
Cough, please.
He's just spreading COVID in the room.
And all of us now?
Let's see, Mr. Harrison. Hey, who the hell are you?
Okay, beat it. The gig's up.
Meet you at the
Building collapsing upon person. Oh, is that the Gucci store? Oh, it's the Vucci store.
Mita.
Oh! Yo, you saw the brain? That's a concussion right there.
How many are there? Allies and their locations.
Ooh, he's made of steel. I want to be that strong one day.
Number and locations of your allies. Now.
Oh! He said, what up? He got kicked, he ate it. He got sliced, he ate it. But he still needs to wrap a little bit of fabric around his knuckle. God forbid it gets cut. I'm just saying. I'm pointing out the hypocrisy. Sorry, anime.
The number of your allies and their locations.
I told you, I don't know!
Oh. Oh, man. Hit him in the abdomen and he's bleeding. That's a bad sign. Not gonna last long, bleeding into the retroperitoneum.
I'm sorry.
God, I'm having flashbacks to my fight with Chris Avila. But see, I didn't fly like that.
You didn't get knocked down.
Never. We never get knocked down. We got a boxing anime. I'm already hyped. Yeah, he is. Yeah, he is. So when you're coming in like that and you have a size disadvantage, you gotta be ready to dip, duck, dodge, and dive. And then if you're the big guy, you wanna keep a distance, and they get close, you wanna clinch. Uh-oh. Uh-oh. Oh! Ah! Oh. Why do they fly when they box? Oh! This feels like boxing meets Pokemon fight. Oh, because he's got abs. Man, they're really slow punchers if they're being able to have this full-on conversation back and forth about what they want to do to one another. Yeah, but you can drop someone with a body shot. Just ask my man Ryan Garcia, who got dropped. Oh, body shot. He went right for the liver. He went bam.
Bam.
That's a weak spot for the body. Like getting hit in the liver just creates this reflex where your body just like go down for survival. His left fist died. There is such thing as a boxer's fracture, which is really important to be dealt with because it can cause the hand to malfunction if left untreated. Oh, he's going up with the uppercut. Oh my God. Dude, if you have the time to say that, just put your hands up. In boxing, unless your opponent's super weak, loading up your punches is not a good move, says someone who likes to load up punches. I feel like an earthquake's happening, not a boxing match. Oh. Oh. Why are they fighting on wood? Well, if I was ever to make a boxing anime, that's how I would do it too.
Bam.
Pincushion. Pin in a pincushion. Oh my God, is she about to suture? I see a tourniquet. Oh. Oh, where's the arm? Is she gonna full on do a reattachment of a limb? You're gonna need an orthopedic surgeon, a vascular surgeon, and she's like, I got this, solo. I don't buy it. The motions were too big for making the small amount of repairs that you need to do when you fix an artery. So I'm skeptical.
隠しといた方がいいかな。種も仕掛けもない。ただのスカーフ。バンジーガムで腕に貼り付け、ドッキリテクスチャーで肌を再現。
Whoa, that's like second skin. I mean, we have like tegaderms and stuff to cover skin and wounds, butterfly bandages, but we don't have this invisible cloak thing. Unless you do a skin graft, but even with the skin graft, you're gonna have sutures visible. Okay, that's a weird looking creature. Why is everyone so ripped in anime? Like, I can't get that. I mean, maybe if you use steroids, which no one should be doing.
That's the idea, Pickle. Now you're starting to get the picture. That's just the kind of thing you gotta do in a test of strength.
Someone needs to explain to me or give me context of what's happening.
Uh-oh, here comes the ground.
Is this wrestling? Is that a vampire? A diesel vampire? Is there a pneumothorax happening? I can hear difficulty breathing from the blunt chest trauma.
Impossible. Pickle, maybe. But for Baki to still be on his feet after a fall from that height.
That's what I always say about Pickle.
I can feel my internal organs are in total chaos from the shock of hitting the ground.
That's called blunt trauma, blunt force trauma. But I don't know what he means by chaos. Like, is there massive bleeding on the inside? Because he's not going to be standing for a long time. You know, the same goes for Pickle.
My diaphragm's being forced up as far as it'll go. It's crushing my lungs.
See, I knew there was a pneumothorax situation because you're doing that coughing. Oh, someone's about to vomit some blood. Oh, that's gonna create a GI disturbance. Swallowing that amount of blood is not good.
I'm spitting up blood. That means major organ damage.
Yeah.
I feel like I want to fall to my knees.
That means you have low blood pressure because you're bleeding internally. Oh, we got a little soccer action.
Soar past my opponents was a joy given to me and me alone. I would outrun them all and eventually become the best striker in the world.
I wonder if Ronaldo says this to himself when he runs around. Oh, he tripped. He broke something. I feel like there's a ACL tear.
I'm sorry.
Is that a femur fracture?
We're looking at a right ACL tear.
Look at that, even in an anime I can make a diagnosis. But there's also the bone was broken.
If he were to experience a tear in the same place again, I'm afraid it would be difficult for him to continue playing soccer.
If you tore your ACL, you're gonna need ACL reconstruction surgery. Otherwise, you won't have forward support. If you don't have forward support, it's gonna be impossible to make good cuts. Like, yeah, sure, if you're older, maybe you could live without one, but not with what this person wants to achieve. Doesn't look like the brace that you would wear for this. You would have support on the side as well.
Hey everyone, Jiggery's back.
All right, come on, they could have done a better job. Oh, is that just captions? I thought that's how they wrote the sign. I was like, come on, it's vibrating.
You've worked so hard to get to this point. Don't push yourself. Just take your time and ease back in.
Rushing rehab is one of the biggest mistakes athletes make.
What's the matter, Mr. Not So Genius anymore? Are you feeling winded? You scared to sprint? Wouldn't want to damage that knee again.
Is that actually a person, or is that like an intrusive thought personified?
It's not wrecking my right leg again that scares me. I truly believed I could become the best in the world.
What kind of angry soccer are they playing where like train track picks are flying at them? Oh, it's a visualization. He's feeling trapped.
Lose that. I lose who I am.
You actually don't unless you make that your identity, which you don't have to. Back to the anime in just a second, but first I want to tell you about Odoo, an all-in-one software that offers a range of applications for small and medium-sized businesses, such as sales, marketing, HR, and my favorite, a website builder. YouTube takes up a lot of my time, as does practicing medicine, but I also do a lot of work through my website, professionalsmediaacademy.com, where I teach professionals how to turn their careers into a media business. This would not exist if I didn't have a website that's connected me with my customers. And that's exactly what you can get from Odoo's website builder. It's so fast that you can configure the entire thing in just a few clicks. And with their simple drag and drop tools, you don't need to have any technical skills to put together a sleek looking website in no time. The best part, It's free. When you sign up for Odoo, you can get your first app for free for life. Choose the website builder and that tool won't cost you a penny. Not to mention they offer unlimited hosting and support, as well as a free domain for your first year. For something that's essential to running a small business, I can't imagine a better deal. Click the link in my description to get started with Odoo for free right now. All right, let's get back to the anime. Uh-oh. Are we doing chest compressions? What's going on? I'm getting excited. Balance the chakras. Oh, we're checking for a pulse. It's a good second step because first step is call for help. We're listening for a pulse. Guess we're listening for a heartbeat. You don't listen for a pulse. Call for help. And then chest compressions, chest compressions, chest compressions. Don't just give him a hang in there. Do the thing. Are they floating on a potato? There is no need to undress someone to do CPR? Oh. They're gonna do the thing. I remember I was out sick that day in medical school when they did the 2-finger insertion into the chest cavity to revive someone. I'm genuinely curious what's about to happen because they're way too low for the heart. Oh. What about the covering of the organs? What about the fascia? What about the pericardium? They said, forget about compressing the chest. I'm gonna slice that dude up, go inside and compress the heart directly. Cardiac massage with green aura. Also, that heart was making a weird rubbery squishy sound. I don't know, like amyloid deposits there or something. Wow, that's high level. Mouth to mouth while squeezing the heart. This has turned from medical rescue to awkward.
Would you recommend, if you could get into the chest cavity, physically squeezing?
I would not recommend touching the heart. And I would not recommend entering one's cavities while they're dead. And I'm just gonna put a period at that sentence and not go any further. Oh, he's going for a spike. What's a wipe? Oh, good save. Oh, good save. It's in. Why am I cheering for a team? I don't even know who's the good guys. Why is there so much tension? Roll him on his back, see if they're breathing. Check the pulse. Call for help.
ラストボール返した直後5番の坊主君と首相君が激突
I mean, he ran into his shoulder, so it should be okay. The only thing is, I'm worried about the positioning of the neck and the spinal cord. Oh. See, I wouldn't allow them to get up. I would have them lay down, come to their senses, and slowly start figuring it out.
沢村君、今いる場所は？
仙台市体育館です。
今の対戦相手は？
枠なんです。
That's actually the correct thing that we would do in a situation like this. When we go to sports and we see if someone's had a concussion, we right away ask them, what's the score? What down is it? What quarter is it? That gives us a sense of how well the brain is functioning cognitively in the moment. Yeah. That is not how it works. You don't regrow a tooth. Bones do heal, but not instantaneously upon drinking milk. Do people know that bones and teeth are not made of the same material?
First, boil the sulfuric acid and add a pinch of salt.
This glass thingy is weird.
Whatever it is, I'm glad they're doing it outside because sulfuric acid can turn into a gas and that's a problem.
We're catching the gas coming out of the sulfuric acid and salt mixture as it drips.
Hydrochloric acid acquired.
Hydrochloric?
It's a slightly dangerous chemical.
It's very acidic.
Get this stuff in your eyes and you'll go blind.
I believe it. Same thing with sulfuric acid. And one of the things that's unique about sulfuric acid is that if you add water to it, like to wash it out, the initial combination of the sulfuric acid plus water actually creates thermal burn. So you get damage in your eye from the lubrication that exists in your eye.
The sinters from the sulfuric acid spring, which some call flowers of sulfur, boil them, throw them into the hydrochloric acid we just made, and now we have chlorosulfuric acid.
And what is that? Why is that better? Is that like the evolved Pokemon version?
We'll separate the salt water with electricity. And we've acquired sodium hydroxide.
What do we do with all these chemicals?
Next up is ammonia.
Where do you get that?
It'll knock that sickness right out of you.
Ew! Did she just drink their urine as a form of treatment?
All right, I finally get to see my patient. Time to make a diagnosis.
You're already treated. Why are you making the diagnosis now?
Say E, loud and clear.
We actually do that test on the lungs.
Sounds like a bleeding goat.
It's the most evil doctor ever.
That's evidence that there's fluid in her lungs.
Does this doctor just see random objects and say we're gonna treat with them?
Red inflammation all over the lungs. So it's definitely a bacterial infection.
Of the rat?
The rats are catching it. Even our cure-all has its limits. It's not 10 billion% guaranteed that it'll wipe out this specific bacteria.
What in the world is happening? I feel like someone that was tripping balls wrote this. The way this works is if someone has a pneumonia, we listen with the stethoscope. If we can't, we do some of these special tests, whatever. And then if we suspect a pneumonia, we usually get an x-ray, but if you're not on an x-ray, you could treat with an antibiotic. But if you're not sure if the antibiotic is gonna cover the bacteria that's there, you can get a sputum culture, and then you culture it and you see what bacteria grows. And if you wanna see if it's resistant or susceptible, you have like little areas where you actually put some of the antibiotic and you see how the bacteria behaves.
The bacteria is getting serious now. It's making allies by spreading its toxic genes into all the harmless bacteria around it.
What the hell is even that?
What the hell is even that?
It's the signature move of the pneumococcus bacteria, which means that Ruri's disease is pneumonia.
Bro, I could have made that diagnosis 10 minutes ago.
Sulfa drugs absolutely slaughter pneumococcus bacteria. Which means that we won with the power of humanity's science.
Just give her Bactrim, bro. But what if she has a Bactrim allergy, a sulfur allergy?
It's a miracle that Ruri managed to live to 18. But if you stay clean and keep warm, the disease's progression slows significantly.
Wait, she's been living for multiple years with pneumonia? I'm confused. Does she have SCID, severe combined immunodeficiency syndrome? I tried my best to give some medical contact. Join. Ow, ow.
I keep seeing these posts about healthcare workers coming home and avoiding contact with their families completely or taking off their scrubs before walking into their house so that they don't spread anything to them. But I personally feed my scrubs to my children every day that I come home from work because I didn't raise a family of Amberlynn, shut the f up.
What just happened? That was the most aggressive TikTok. Is that a joke? Yeah, you should absolutely take off your scrubs before you see your family. And take a shower. Like the first thing I do when I come home is like, shower time. She said I feed it to my children. I was like, oh my God.
Megan just asked me, have you ever twerked to orchestra?
This is amazing, not only because she's truly twerking to classical orchestra music, but because they're clearly having fun at work and we need a little bit more of that. I also have so many videos just like this from my residency days.
Things that don't belong in your body, part 4.
Part 4? I want to see parts 1 through 3. I'm fairly sure dumbbells don't belong in the human body. The weirdest ones I've seen, pipe cleaners, like you know those little furry ones when you're a kid, in a male, and carrot. I'll leave it at that.
Wait, hey Becky, I just wanted to check in with you. Are you doing okay? Do you need anything? Who, me? No, I'm fine. It's actually kind of quiet today.
Code blue, 4th floor, 4B.
Oh my gosh, it got busy.
I've said it time and time again. You do not say the Q word. It's funny that I'm getting all stressed out about it when I was the guy. Like, oh, it's kind of quiet. 10 rapid responses, 4 admissions, 2 code blues. Oof, oof. They took like the most gangsta driving thing. I don't even know what competition this is. They put piggy noises in the back of it.
soap is an amazing substance.
Oh, Bill Nye, the science guy. We, by the way, became quite close friends at the Men in Black premiere. We actually tried to get him on the YouTube channel. We're still making that happen. Maybe you guys can exert some forces, some gravitational-like physical forces, and encourage him to come on the channel.
Each soap molecule is like a string, with one end that sticks to water and the other end that sticks to oil or fat. So take a look at this. This string floating on water represents a coronavirus molecule. Watch what happens when we touch the surface of the water with this bar of soap. 3, 2, 1. The molecule falls apart. That's why you've got to wash your hands, wash your hands, wash your hands. Woo! Take that, virus molecule.
Just so everyone knows, that sound effect is not actually what's happening when you wash your hands. Can you imagine how noisy bathrooms would be? But yes, soap does destroy the membrane, thereby killing viruses, bacteria, and the added benefit of washing your hands with soap and water, getting rid of foreign residue, dirt, and things like that.
That moment when your doctor's office calls you and says, "Oh my goodness, we're so sorry, we forgot the extra screening that you requested. Can you come in and do a urine sample for us?" And then you say, "The extra screening I requested," and they say, "Yes, you wanted an STD test for chlamydia?" And then you say, "I'm pretty sure I don't have chlamydia. I did not request that." And then they say, "Uh-oh."
That shouldn't happen. If a patient of the same name came in at the same time and there wasn't a name alert given either by the system or by the staff, you have called back patients incorrectly. And that can get very, very problematic because, as you know, healthcare information is a protected asset. This is the honest truth behind social media, by the way. Look, they always look so glamorous and they're never tired. Like, Dr. Mike, how do you come home from night shifts and look like you're wide awake? I don't. I come home and I crash.
I need a TikTok doctor. Look at it, it's so weird and inconsistent.
When you're constantly typing, especially sitting in that non-ergonomic position where your hand is cocked backwards like that, it's quite uncomfortable. And as a result, when you overuse a muscle, especially one that's undertrained, you can cause spasms, cramps, and they happen just like that. Nowhere in the world, in legitimate medical schools, do we teach that Himalayan salt lamps can do anything outside of maybe look kind of cool on your bedroom decor, because, you know, you want a light, but you also want to show that, like, you're with it, you're with the geo, you're like a geo person. To not go on a journey looking to boost your immune system if you have a normal, healthy immune system. The definition of homeostasis in a normal immune system is one that is not boosted, because a boosted immune system is an autoimmune condition where your body is so boosted it starts attacking itself. Don't boost it. Right? Yep.
Where's my room? Just take me to my room.
Sometimes I look at my nurses or CMAs and they're bringing patients in, and sometimes they're like they're being polite, so they say like go right ahead for the patient to walk into the general area, but then the patient has no idea where to go.
Truth about sunscreen. Sunscreen is poison, guys. Do not use sunscreen. Okay, so this is the truth now.
No, it's not.
Light-skinned people are not supposed to burn the sun. When I was younger, I would burn the sun. Now, I never burn. I get 5 to 6 hours of sun every day. I try to at least. Okay, so this is the key. You have to change what you're eating. What you're eating, if it's acidic based and all that junk food and garbage and all that meat, it's gonna make it so your skin burns in the sun. If you switch to organic fruits and vegetables, you're not gonna burn in the sun anymore.
I feel like he's burned right now. Like, what is he talking about? Do not even experiment with this. If you go outside, you will get a sunburn if you're in the right place with the sun hitting you for an extended period of time. And guess what? With each burn that you have, you are more likely to develop a skin cancer. And one of the most deadly and scary skin cancers are melanomas. Well, if you get a melanoma and you don't catch it and it spreads, melanoma spreads to the most random of places. Muscles, bones, liver, your eyes, your neurological system. Please wear your sunscreen and don't listen to Jimmy B, Rose TV, or whoever this is.
We want nice, steady compressions. What? Look at Trap. That's CPR that'll save a life.
Oh, thanks. I used to be a lifeguard. What happened?
What did you do? I don't know.
Where am I?
You were too good at CPR.
I wonder if I did my chest compressions I'm nervous already because two problems arise here. One, running a marathon with no prior training, incredibly bad for your body. Now, I'm not just talking about your joints, your muscles, your tendons. I'm talking about your kidneys. When you have a rapid breakdown of muscle tissue, which happens during a marathon because of the tremendous stress your body's under, you actually break down that muscle tissue, releasing myoglobin, which is actually toxic to your kidneys. No joke, I've seen people who were untrained run a marathon and then pee blood after.
Wow.
And then running in the shoes, obviously, that's ridiculous. My man, everything's gonna hurt. Anything you put into your shoe, the amount of foam there, the flexibility of your sole, that will affect your ankle, then your knee, then your hip, then your low back.
Each of these shoes weighs 5 pounds. That's 10 pounds in total.
You know what's gonna probably be sorest on him? Knees for one by far. Also on his anterior tibialis muscle, because that's the muscle that has to bring the shoe up in order for you to take a step without tripping. And it's gonna be even worse with this giant shoe.
The shoe was constantly scraping the side of my feet and it was getting extremely painful, so we had to do some modifications.
So they're wearing a shoe over a shoe. Do you see how important proper footwear is? The human body works through a biomechanical motion that has evolved over millions of years. And it's all very well thought out. It's a beautiful process, actually. Your weight distribution, how your foot strikes the floor, how the muscles bear the weight of that impact, and how your arch is supposed to take in some of that force. You negate all of that by strapping this giant shoe to the bottom of your foot.
And this is Joey Chestnut.
Oh, Joey Chestnut. Joey Chestnut crushes it at the hot dog eating contest.
What the freak is he doing? This is as fast as I can eat.
Competitive food eaters scare the life out of me because I have no idea how they consume an absurd number of calories and don't A, put on weight, B, don't rupture their stomach. It's just like a magnificent feat. It's almost like magic. Think how much salt is in there, how much sodium is in there. That's a huge load on your kidneys. What do their bodies go through?
There's no way I can do this, man.
Oh, he does it so fast too.
One final bite.
Done.
Oh my God. Before we started, we weighed him and he weighed 229. Let's go see what he weighs now.
That was one of the hardest challenges of my life.
Step on the scale. Let's see how much weight you gain. No way. He weighs 250.
Well, he drank a lot of water too. God, I can't imagine what going to the bathroom after that must be like. Not gonna lie though, I would probably fare pretty well at this.
We will be spending 24 hours in this insane asylum.
First of all, we don't call them insane asylums. We don't have insane asylums like this. We actually also moved away from using restraints in patients. We prefer using someone to watch over them, perhaps medication options to help calm them down. But this is just like really barbaric. This is like what used to happen 200 years ago.
So we were letting Chandler poop and
I tore my labrum and my shoulder like popped out of socket and it really hurt.
How did he tear his labrum?
Ooh.
The fact that his shoulder dislocated is a really big problem. The most common form of shoulder dislocations are anterior shoulder dislocations. You need to put them back because otherwise it's really a lot of pain.
The doctor has said that they're pretty sure that I've blown either one or both of my eardrums because my eardrums are full of pus and stuff like that, and I have an infection.
This is a difficult explanation here. He may or may not have blown an eardrum, which you could see if you just do an otoscope exam there. If that's the case due to an infection, that would be treatable with antibiotics. So I'm not sure if there's like a eustachian tube dysfunction that's also simultaneously going on, which is the tube that connects your sinuses to your ears, which can make like popping sensations, pressure differentials become quite painful. The idea that he has just like nighttime ear pain randomly warrants further investigation, or at least a better explanation for me.
In this video, we will be eating a $70,000 pizza.
That's an expensive pizza.
You have an ounce of gold that's covering the crust, 10-year-old Parmesan bechamel. Japanese beef has been marinated overnight in a $10,000 bottle of
This is so ridiculous.
Hudson Valley foie gras.
This is only in America. Gold is an inert substance, so it's gonna just like go through your digestive system and you're gonna poop it out. Not something I recommend eating regularly. Don't eat metal. Like, I feel like that's a pretty standard piece of medical medical advice.
Oh my god. Straight up, I really, really like it.
No way!
So we're going to act like my channel was hacked, and the only way for me to get my channel back is to raise $1 million through selling body parts and organs. You see, your body parts are actually worth a lot.
They are, but they're not legal to sell, especially here in the United States. There is actually one country where you can sell your organs and it is legal. It's one country in the whole world, Iran.
Kidneys are $200,000. Whoa! I can get 200 grand for a kidney.
You can live with one kidney, but you have to be very careful in that instance because you got to take care of your sole kidney. You got to watch out for medications that you can take that can negatively impact your kidneys. Advil, Motrin, Aleve, things that you wouldn't even realize could pose a serious risk to your kidneys.
Skeletons, 3 to 5 grand now.
Who's selling skeletons? He's definitely reading like a board game thing. Like, this has nothing to do with reality.
Livers. Okay, so according to this article, obviously you can't live without.
No, you can't live without your liver, but if your liver is damaged, it does regenerate, and if you cut pieces off, we actually see it regenerate.
So technically, if I donate half my liver, the other half will grow back. Therefore, I'm definitely selling half my liver, so we're gonna add that to the list.
He has a Microsoft Word file open selling his organs.
According to this article, people can survive even if an entire lung is removed.
I actually had a friend growing up. His dad was unfortunately attacked in New York City as a taxi cab driver, and he was left with only one lung. You can live with one lung.
A gram of bone marrow is worth $23,000 on the black market.
You could actually do bone marrow donations even now for people who are battling cancer. For example, my mom needed bone marrow donations from individuals, so don't expect to get 23 G's though.
I'm going to attempt to sit underwater for 24 hours straight.
This one's painful to watch because a lot happens here.
I have this tube right here, and this tube is going to be constantly feeding me oxygen.
There's just so many variables and stresses that his body's gonna have to face. Like his skin's gonna prune. He's not moving well. Cramps of his muscles. He's also gonna have obviously sleep deprivation because he's gonna be up for 24 hours. There's just a lot of things that can go wrong and very easy for him to feel unwell and need to leave the challenge.
And my hands are so soggy. Oh my God.
Also, I think this is a chlorinated pool. Extended exposure to chlorine actually can cause skin irritation, damage, rashes. When you see individuals spend a ton of time submerged in water, their skin actually starts breaking down, and then they start getting fungal and bacterial infections. The skin prune thing is probably the most interesting part of this video because a lot of people assume that skin pruning has something to do with electrolytes or things like that. That's what I even used to think. This is an autonomic nervous system response that helps us better navigate wet surfaces and wet objects. And the way we actually found this out is because we found those who had nerve damage to those areas weren't pruning in water. So it's crazy that our bodies have evolved in order to help us survive when we get wet by giving us extra traction as if we had tires on our feet. How cool is that? Like, I wish he had an oxygen sensor in there to know how much oxygen he's getting. There may have been periods of time where there was a lot of CO2 in there, not enough oxygen. He could have easily started developing hypoxia from lack of oxygen in there.
So, little update, it's actually starting to get a little freezing in here.
The water being not body temperature, even if it's 70 degrees, even though it may feel okay, it could actually cause you to develop hypothermia in like a few hours because the water is so cold and your body's not acclimated to this because your natural body temperature is around 98 degrees. You can start developing hypothermia because you aren't able to keep your body temperature up.
But I randomly started feeling extremely sick while sitting underwater, and I had to come out. Like, I just had this strong urge to throw up. I think it's because the water was constantly moving. I was just getting really seasick under there.
Seasick, hypothermic, pruning, it's hypoxic, not enough oxygen. There's just so many variables in here that make him feel unwell. It's not surprising that he had to come out.
I'm gonna spend the next 50 hours buried alive in this coffin. Probably the dumbest thing I've ever done.
This one legit scares me because he's gonna be trapped in there for a while.
Oh, stop.
Oh my God, imagine he fell through it and he just fell right onto his body, broke a rib. Oh.
I tried to turn around. It was like very narrow on the other end.
I love that he has food and hydration. That's all important. I really hope he stays mobile in this thing. By not moving for long periods of time, blood actually stagnates in your body, especially in the lower extremities. You can actually have clots form that then can get loose, shot up into your lungs and cause a pulmonary embolism.
You've officially made it underground 24 hours.
Wow.
Really? So how do you feel after being in underground for 24 hours? My back hurts, Starting to feel claustrophobic.
Claustrophobia is a legit phobia. A lot of people suffer with this. It's one of the top phobias in the United States. When you're not moving, you're putting pressure on certain areas. You could actually develop bed sores. For patients who are paralyzed, we have to constantly reposition them. Otherwise, we have decreased circulation of skin to that area. It starts getting red at first, and then it actually opens up as a sore. It can turn black and like a full hole in the body.
I have to poop really bad, but I've decided just to hold it.
Not pooping for 48 hours is not the end of the world. You know, patients can go a week without pooping. And obviously that's like a constipation diagnosis, but it's not something that is lethal or deadly. This is probably the most dangerous part of this video because if any of that fireworks smoke actually got into his coffin, he can actually get really sick from carbon monoxide poisoning very fast. And they might just think he fell asleep, but he's actually developed carbon monoxide poisoning. That's one of the symptoms. Do not allow smoke to occur in an enclosed space. That is literally deadly. The reason I actually reacted to all these Mr. Beast videos is because I've teamed up with him and creators from all around the world to promote Team C's and the international effort to raise $30 million to remove 30 million pieces of trash from our oceans, rivers, and waterways. All you have to do is head over to teamcs.org to learn more and donate as little as perhaps. P-whoop.
I woke up. All I could taste was blood.
Likely because there are incisions made in the mouth to attach said trap.
And metal.
Another common reason why people wake up and have the taste of metal in their mouth is due to acid reflux. Because when the acid comes, I mean, that's not what's happening here, but what happens in acid reflux is acid can regurgitate out of the stomach where it's supposed to live, go into the esophagus, cause heartburn, and then if it goes all the way up to your mouth, you could taste it, and people say it tastes like metal.
Hello, Amanda.
Why are the creepiest, scariest villains also kind of cute?
You don't know me, but I know you.
See, I would find it weird if she did know him. Like, imagine she's like, "You're the guy that I went on a date with last week."
I want to play a game. Here's what happens if you lose. The device you're wearing is hooked into your upper and lower jaws.
Oh my God, it's like the opposite of a jaw trainer. It's like a jaw untrainer.
When the timer in the back goes off, your mouth will be permanently ripped open. Think of it like a reverse bear trap.
Oh, God, that's so terrible. And you know, the upper jaw is not gonna go anywhere. Like, you can't fling the head back, really. So it's really just the bottom jaw is gonna get torn off. Why am I saying it? It's even worse when a doctor says it. I mean, he should have just said, "Your head will explode." He did not need all the medical necessity.
There is only one key to open the device. It's in the stomach of your dead cellmate.
It's in the stomach of your dead cellmate? Did he make him eat it? Dude, not gonna lie, if that was me, I knew they were dead and I'm about to die, I'm scurrying like a rat. And the only reason I'm aware of how rats can scurry into someone's inside is because I watched Fast and the Furious. What was that movie where the villain put the metal bucket on the thing and heated up the bucket and then the rat started digging down into the body? An added detail you did not need to hear, but let's get back to the show. That's how I felt my first day as a med student in the operating theater. But the pressure's almost the same. And he's awake! Maybe he can help. Maybe he could just... See, I was a doctor, I would have such an advantage here. Don't cut him open. Stick your fingers in his mouth, he'll throw up the key. Oh, no. She doesn't have good surgical technique there. It's too abrupt. You're not gonna have good accuracy. You might even miss the stomach. You wanna be a little bit more precise with the scalpel. Like her grip wasn't great. Is she gonna get it off? See, the hands being slippery adds another variable. And they said Michael Jordan was clutch.
The device Timothy is strapped to is my personal favorite.
The fact that he has a favorite, I'm already freaked out. See, that's causing a lot of damage. Even if you survive this, the fact that there are open wounds direct through the hands and feet, you're gonna have a high chance of developing an osteomyelitis, which is infection of the bone, maybe a septic arthritis. Like if you're not getting IV antibiotic stat and for a long period of time, you're gonna be in trouble. Is it gonna pull? That's past anatomical range of motion. He's gonna have severe disfigurement shortly if someone doesn't act. Do you watch this for fun? You bought a ticket and watch this? I have questions for you after this. That external rotation, the hip dislocation that's about to happen. Oh, that's a compound fracture. Not compatible with being alive when the head is 180-degree rotated, looking the other way. The spinal cord doesn't work well being wrapped around itself in that manner and becomes severed and paralysis ensues.
Hello.
Hi.
I want to play a game.
Arteries there. In fact, there's a test that we do that taps on this that checks for giant cell arteritis. She's going straight for the fingers. I don't imagine the fingers carry a lot of weight because the way that I think about it is fingers are mostly bone and bone isn't particularly heavy. You want to go for an area. I shouldn't talk about this. Oh, she went for the full forearm. I don't think one can do that without losing consciousness. This is one of the most bloody scenes I've ever seen besides that one scene from Kill Bill. See, I think she just bleeds out. I don't think there's no way that tourniquet that she has is doing anything good. Also, not easy to do that, especially with the two bones there. Radius, ulna, it's thick.
Hello, Mateo.
Oh
it's
my
time to play a game.
Oh my God.
The rules are simple. Place a big enough piece of your cerebral tissue into the glass enzyme tank, and you win.
Place a part of your cerebrum into the tank and you win? How do you know if you win? You know, the brain doesn't actually have pain receptors. Like, the covering of the area does, meninges do. I don't understand how this is setting up someone for failure. Like, I've seen attendings do this to med students and residents. Not ask them to perform brain surgery on themselves, but ask them an impossible task or impossible question. And I always found that really unfair. The scalp also bleeds a lot. There's a lot of tiny capillaries. And for anyone that's ever had a scalp laceration, you know that. And you know, we actually heal scalp lacerations, not usually with sutures, but with staples that we then have to remove. So he didn't do it.
Your health and hereditary background put you in the highest category of success.
Can you imagine being married to that actor? Why are they on ribs breaking is so painful. Why did I sneeze after saying that? And when you have a fracture like that, you're gonna scream even more, requiring more oxygen, therefore the process is gonna happen even sooner.
These laser cutters slice through tissue and bone like butter. The most powerful blade on the planet.
I messed up your x-rays!
That's why one of the first things we're trained to do whenever we get a report, an x-ray, and EKG is match the name with 2 patient identifiers. I mean, that's instant death because maximum damage to the carotids. That's it. No, why do I feel like something terrible is about to happen and it's scaring me? No, something bad's gonna happen. That's a powerful laser. I gotta use that for my bison next time. Bison tenderloin? All right, not the time. Begins in 5. Yeah, bacteria just get on right away. They just hop on. They don't wait. They make contact instantly. They're like, what I imagine working in urology is like, Dr. Wiggles wiener. Yes, but without the ice cream. Butter is such a superfood that it has its own penthouse in the fridge. Oh my God, it doesn't just have a penthouse, it has a penthouse with a view. And also, there's apparently like a way to keep your butter inside water that keeps air out of it or something, or keeps it soft. It's too complicated. I need like an astrophysicist to come on and help me with that.
Do you think butter is a superfood?
I think it's more of a villain food.
Ooh, super villain food.
Super villain food. I have good news and I have bad news. Well, doctor, give me the good news first. The good news is in for the patient in waiting room 2. Oh no. Why does the patient have such a little head? I'm
concerned about the size of the head and the knee squareness.
Putting on gloves alone in front of other doctors. Yo, it's easy to panic. And you know what makes it worse? Hands get sweaty. When your hands are sweaty, it's harder to put on a rubber glove. And forget about it if they have those like vinyl gloves. It's game over because those, they're just tearing. And when you tear one, the nerves get even worse that you're gonna tear 2, 3, and 4. Do not eat aluminum or you'll sheet metal. Oh, that's good. I would change it though. Do not eat aluminum or your stool will smell like metal because there's blood in it and blood has iron in it.
Much funnier.
Right?
Way funnier.
And accurate. And also, it's a donut shop. Snow White being intubated? But why was he intubating her? Was he needing to protect her airway? Was her Glasgow coma scale lower than 8? Because if it's lower than 8, you intubate? If not free healthcare, maybe ad-supported healthcare. I never thought about that. Like my doctor can stop in the middle of examining me and sing the Liberty Mutual jingle. Liberty, 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 liberty. I'm surprised that's not happening. Like, you know, NASCAR drivers have logos like everywhere on their car, all the real estate.
On the Charlotte Hornets.
Exactly. So like at what point do doctors just start renting out space on their scrubs?
Ship station.
There's a universe inside of you. This is definitely tuberculosis. This is definitely ground glass appearance, and I'm concerned. And there's a universe of something inside of you when you have ground glass appearance. Potentially an infection. I don't think tuberculosis. That's a cavitating lesion, where you would have a single solitary lesion that looks like this. Oh my God, it's a radiology course inside of a meme review. When you try to swallow a pill, but it doesn't go down and is now dissolving in your mouth. Oh, I hate that feeling. No. That's bad, and I absolutely do struggle with this, but you know what's worse? Oh, there's water in this bottle. Let me take my pill. Put pill in said mouth. Pill starts dissolving. No water in here because you ran out, you didn't realize, and now the pill is just sitting there in your tongue. Jacuzzi simmering in there because the temperature of your mouth is around 98 degrees, 99 degrees, which is what a jacuzzi is like. And in a jacuzzi, you tend to simmer in there in the warmth and you slowly disintegrate and your skin shrivels up. That's what's happening to the pill. Don't tell me you're okay. You're not okay. I can smell the hurt inside you. Don't walk away. Talk to me. Beware of emotional support dog. This is actually one of the top dog comics I've ever seen. And Bear's an emotional support dog. Bear, where are you? This is the other emotional support animal. He's grown a lot since the last video. Who's a big tummy? Jack Link's oops all moisture packets. Oh, that's funny. And it's ironic that there's moisture packets that say do not eat in a package of food that you will eat. You would think that they would find a unique way to deal with this problem. Hospitals when I donate a kidney, hospitals when I donate 30 kidneys. Yeah, where are you getting kidneys from? When the 2 cans of Monster you just slammed are making your heart beat too fast, so you have a beer and a Xanax to bring it back down again. Health. Please do not become your own chemist where you start playing with your health. Even the combination of alcohol and cocaine creates a substance known as cocaethylene, which is so toxic to our bodies and lasts for much longer. Don't do that. When you have a date right after surgery. Oh my God, are those high heels underneath? Pesto Bismol with garlic. I don't think that would help an upset stomach. I think that might irritate it. Oh, this is great Photoshop though. This is pesto. You heard of Elf on a Shelf? Get ready for skeleton on a Peloton. And the jaw is quite literally dropping. Chest compressions are useless, and it's better to wait for medical professionals to come help. I'm about to get very unhappy. You're about to get very unhealthy. No, they're not useless. They buy you time in order for medical professionals to get there. So if you're alone, you better be calling for help first. If you're not alone, you'd ask someone to call for help while you start doing the chest compressions. Because the faster you get to doing chest compressions and the longer you stay doing them, the better the chance the person has to be brought back to life by advanced cardiac life support. My sister is about to have a baby and my brother showed up to the hospital in a suit because first impressions matter. Maybe your brother is making a move on some of the employees that work in a hospital. They're holding down a steady job, they're very interesting, they deal in high pressure situations. He's just thinking about his dating life. Oh, maybe he was doing it for the baby too. Women choosing a deodorant. Cherries, passion fruit, vanilla. Men choosing a deodorant. F-16, sharks, war. Yeah, that's like the whole thing behind Axe body spray, which by the way, is not only ridiculous how much we used to put it on ourselves in high school. Like literally, we're just like, shh. And it was so bad. It was probably so unhealthy for our lungs. And you know what I used to do as a kid? This is not recommended. I would take one of those like long lighters and shoot the Axe spray at it. And I thought that was so cool until I realized it could explode on me. Not recommended. No doing that. A year in the gym versus 2 weeks out of the gym. Why does it feel like that? And you know what's funny? I've been out of the gym for like a decent amount of time and I need to get back in and I need motivation. So please, if you wanted to leave me a motivating comment, it would help. Dilation pumpkins made by midwives at a hospital, disturbing but funny. Oh, that's actually pretty helpful. We actually have a kit for this that looks like this to teach residents and students about different dilations. And we're talking about cervical dilation, by the way. Giving birth isn't as painful as being kicked in the nuts. Have you had a baby? No, but over the years, women say, let's have another one. I never hear a man saying, come on, hit me in the nuts again. Clearly, you've never watched Steve-O on Jackass. How long will you guys leave out a glass of water in your house and still drink it? It's not like it goes bad, but after a while, it's weird, right? No, it goes bad. Just because the glass was washed does not mean there's no bacteria in it. Bacteria kind of flows up in the air. So like the water allows the bacteria to multiply. Anything where there's moisture, bacteria can multiply. Please don't drink old, soggy, bacteria-flavored water. I just poured this like an hour ago. This is fresh. And actually, this is from Harvard. So you know your boy got credit for going to the Harvard Kennedy School and doing a talk about something. Keeping tropical fish at home can have a calming effect on the brain due to all the endorphins. Endorphins. I was like 2 seconds too late. There's definitely endorphins. There's definitely some kind of visual effect with the lights and the fish and all the stuff, the colors. Children pothole.
Bruh. Pothole. Sound it out.
Children or Chipotle? Like whether or not you want to have children or Chipotle?
That's right.
Basically, do you want a food baby or a real baby?
There you go.
Woo! We're halfway there. Woo! This is one of those memes, isn't it? A lemon pear? A pear on a lemon. Lemon on a pear? Lemon top. Lemon pear top lemon. Lemon head. Citrus sweet. Sour sweet kids. What are they called? Sour sweets? Sour Patch Kids.
You messed up everything.
Hold on a second. This has something to do with the song. Ooh, we're halfway there. Oh, we're almost there. I don't know the lyrics.
You actually already said the answer. So the song goes, whoa, we're halfway there. Whoa!
We're living on a pear.
Or?
A lemon on a pear.
There we go.
Yeah. Anesthesia was invented in 1846. Doctors in 1845, knocking you out. No, I don't know what they did. They had to have done something. They probably got